Pelvic pain is in men is a lot more common than you realize, and treatment doesn't have to be invasive. Men often delay care because, you know, they just don't want to see the doctor. They just are not open to what's out there, and they put it off unless it involves their penis or constipation if it's chronic and interfering with their lifestyle. So the key non-invasive treatments are and start with breathing. I'm talking about biological breathing. If you have not subscribed to my channel, you have no idea what biological breathing is. I'm going to make sure we put it at the end of this video, but make sure you subscribe to the channel so you become aware of all the different things that I put out there. There are so many videos I've done because I do want you to understand and educate yourself, but you got to understand catching a problem is much easier to tackle than when it becomes long-lasting issue. When it comes to pelvic floor dysfunction, it's a dysfunctional patterns of movement that are existing. That means in your profile of movement, you're doing things that are feeding your problem. How do we go about fixing it? Of course, we always start by identifying what is going on, what's the level of instability. Pelvic floor dysfunction is pelvic instability, and that instability comes from the pelvis itself and any other attachments that to the pelvis. That's the spine, meaning the structure above, and the lower extremities. So if this problem is chronic enough, all of these are impacted, and the muscles inside of your pelvis are simply responding to the outside environment, and what's not happening on the outside properly is being handled by the inside. This leads to tension here. This leads to weakness of certain parts. This leads to irritation of whatever resides here, which is your bladder, your prostate, your intestine, there are nerves, arteries, blood vessels, joints, ligaments, and of course muscles. So we want to do developmental exercises to bring proper profile of movement, functional profile into your movement patterns. Developmental exercises are the same exercises every single walking human being has done to get themselves from that infant stage to then sit, to crawl, to walk, to run, and become mobile, be able to balance themselves and be functional in their movement. Injuries, lifestyle choices, how you sit, all that stuff, and trauma, sports, things like that definitely impact our stability of the pelvis and how we move. So postural training after developmental exercises are implemented are crucial in reversing your pelvic floor dysfunction. Of course, we want to look at the lifestyle choices that you're making. That includes how you're working, how you're driving. It includes habits like masturbation and things that you may do and not relate to your pelvic floor dysfunction. Stress management is also very, very important. In women, we tend to keep the stress in the neck and upper back, sometimes in the pelvis. In men, it seems to be only in the pelvis. So that's where you keep your stress. That's where you clench your butt. That's how you clench your perineum. This is how you pay attention. See if you're holding your breath, if you suck your tummy in. When you're walking, pay attention to your perineum. That's the space between the back of your penis and the front of the anus. See if you're clenching your butt to even stand or walk. All of these are signs and symptoms of pelvic floor dysfunction that are correctable using developmental exercises. That means you do not isolate the area to try to address it. You look at the whole body being involved with the supporting the area that we're focusing on. It's kind of like a concert. When you go to a concert, you see maybe the spotlight on the pianist, but there's still background musicians that are playing that. If they suck at it, it's going to impact the concert. So isolating an area and going after the problem is not how you solve the problem. That is not how it's done. Make sure you subscribe to my channel. Make sure you contact me if you need help. I've done tons of videos, all free, available to you. But if you need help, contact me. I'll be more than happy to hop on a call and see what's going on and see if this is something I can help you with. Until next time, take care.